Hello guys, welcome to my YouTube channel. My name is Dr. Samuel. Today I'll be talking about erectile dysfunction and a very common drug used in its treatment, known as sildenafil, or you can call it Viagra. First, what is erectile dysfunction? Erectile dysfunction is recurrent or consistent inability to achieve and maintain an erection enough for sexual function. Many people have occasional erectile dysfunction. This one is considered normal due to very many factors, the likes of a partner you are having and mental status. When you are too stressed, you can't of course have an erection. So how does erectile erection occur? When you are sexually aroused, nerves will send message to the brain. Then the brain will increase blood flow to the penis. Yeah, in the penis we have two chambers. These chambers, when filled with blood, they become very rigid and hence causing an erection. The blood flows into the chambers but does not get out. So there's an inlet to the chambers, but leaving the chambers is minimized. Yes. So there are some main factors in erection I would like us to discuss about first. First, I'll talk about sex hormone. For you to be sexually aroused, you must have sex hormone. This sex hormone is called testosterone hormone. So for you to have a normal functioning sexual excitement, testosterone hormone should be within its normal range. Another thing, after being sexually aroused, the nerve must send the message to the brain, meaning your nerves must be okay. Yeah, you should be free from any disease of the nerve for you to function well. Yeah, so in the brain also, because message is being sent to the brain, you must also be mentally okay, psychologically free from any stress which might cause you to have not to have an erection. Yes. Another thing is, remember, after that brain will stimulate increase of blood flow to the penis. So your blood vessels which carries blood to the penis must also be okay. Blood vessels must be okay, and the pump is the heart. Heart is the one pumping, is the organ pumping blood to all parts of the body. So it also must be okay for you to have good erection. There are some risk factors. Yeah, there are people who are having these factors I'm about to say are predisposed to have erectile dysfunction. First, I'll talk about men over 40. 50% of men over 40 are suffering from erectile dysfunction. Cardiovascular conditions also predisposes you to have erectile dysfunction. Cardio means heart, vascular means blood vessels. So heart and blood vessels problem will predispose you to have erectile dysfunction. Hypertension also causes erectile dysfunction. Cholesterol levels, remember in blood vessels are hollow. Yeah, they are like tubes. So people with high cholesterol, you'll find that the fat, there will be fat along the lumen, along the hollow, which reduces the lumen, hence causing reduced blood flow. Another thing, obesity, same explanation occurs to obese patients because of the fat in the blood lumen. Smoking also narrows the blood vessel. There are other things like sleep disorder, lack of exercise, yeah, and of course nerve conditions. So let me go to the specific causes. Yeah, first, low testosterone hormone. You have told you sex hormone. If you have low testosterone hormone, you won't have the drive for sex. Diabetes is also one of the leading causes of erectile dysfunction. People with diabetes, 1/3 or 33% of people with diabetes have low testosterone hormone. And also diabetes affect nerves. Let me say in layman terms, diabetes kills nerves and also narrow the blood vessels. Yes, another cause is cycling. People who are cycling will put a lot of pressure, yeah, if you are very keen on the chair of the bicycles, the part you'll sit on the bicycle, that part, there are some nerves which pass through there. So when you put a lot of pressure there, the nerves will be numb for a while. So you'll have temporary erectile dysfunction when you are cycling a lot. Another thing is depression, anxiety, all of the psychological issues, stress, depression, anxiety, yeah, all those can also cause erectile dysfunction. So I want to categorize these into two causes into two. First cause I'll categorize as psychological, things to do with brain, mental, and another thing I'll categorize as organic. So psychological are brain issues which causes erectile dysfunction. Yeah, all those others are categorized as organic causes of erectile dysfunction. Psychological. With psychological erectile dysfunction, the onset is always sudden because it's not a disease in you, it's just your mental state. So it's sudden. While with organic, it's gradual. It occurs over slowly, but progresses over a long period of time. It's a disease. Like for example, let me say people with heart conditions. If your heart won't be able to pump blood enough to the penis, you won't have an erection. But you can't have sudden heart problem. The problem must be gradually. Yes. Another thing is specific in psychological. It's specific in situations. Like when you are stressed, it only occurs when you are stressed. When you are disturbed mentally. Yeah. While in organic, it occurs all the time. It's a disease you are having. Yeah. So it will only improve after treating the disease causing erectile dysfunction. And another thing on psychological side, erection, night and morning erection occurs. While in organic side, the erection is not there. You won't erect at morning hours or during the night. Yes, I'm going on treatment. Treatment really varies. Yeah, varies with the cause. So first you should take comprehensive history, to know the cause first. After knowing the cause, then you can treat. Now let me start with treatment. Like in the case of low testosterone hormone, first you should go to the lab. They check your testosterone hormone levels. If it's low, there's testosterone replacement therapy, where you'll be injected with sildenafil or Viagra. Viagra is quite effective in many people who are suffering from erectile dysfunction. There are a lot of misconceptions about sildenafil, Viagra, which are not true. Viagra is very safe. Very safe. The only contraindication is those with vasodilators nitrate, patients who are suffering from heart conditions, condition in the heart known as angina. People who are having angina are using drugs known as vasodilator nitrates, the like of isosobide mononitrate, isosobide dinitrate, hydralazine, or minoxidil. Those using all those drugs are contraindicated, are not allowed to use Viagra. There are some drugs, when injected at the penis, increases blood flow, hence causing an erection. But it's a short term. You only inject when you want to go to the act. It only works for around 30 minutes. Yes. Then there's a constrict. There are those people in the how erections occur. Remember, I told you there's a inlet with no outlet. So there are some people with inlet and outlet. The blood is escaping, which will not happen when you are erected. So there are some people who prevent the blood back, the outlet, by a ring. They place a ring in the base of the penis to prevent the blood from escaping. Yes. And also there are surgical treatments. Surgical treatments are insertion of implants, implantable implants, implant is being something like a rod, balloon like is being inserted in the penis, along the penis, and then it has a pump. Pump is placed at around the scrotum, so you pump when you want to have sex. You pump it. Another cause is reconstruction surgery. Remember, causes there I've told you about blood in the fat in the blood vessels. Yes, so in surgery you can do surgery to remove the fat or what might be causing narrowing in the blood vessels. Another thing is blocking blood. I've told you about the inlet outlet. So by blocking, you can do surgery to reduce what might be causing blood to escape from the penis, which should not be happening. Yes, I hope you understood. Yeah, tune in for my next teaching. Bye. My name is Dr. Samuel. Don't forget to subscribe.